Winter Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Okay, most certainly, and been accentuated there by this just forthright talk. We're talking healthy, wealthy, it's maybe stealthy health this morning, and as always, good morning, Trudy, and your guests. Welcome to Health Vibes.
Good morning to the listeners of Q95 FM Radio, and good morning to the listeners of Health Vibes. It is another Wednesday morning, beautiful Wednesday morning in the Nature Isle, and the Johnny's team is on with you as usual for another program of health education where we try to bring you a little vibes. Franklin, thank you for the intro.
I'm not quite sure if I can hear you as clearly as I would have loved to hear you. So ensure that your microphone is functioning by you, one in front of you. Yes, I'm not hearing you as clearly as I would like to say. Say hello. Let's say good morning.
Hi, good morning.
Okay, so we're going to do a transition here. So yes, you take this one here, not this one, Trudy.
Let's try.
Not this one, hers. Okay, so this is the big station Q95. We're just doing a few changes there so we can hear you. We can make sure everybody hears clearly. And yes, welcome again. Good morning, Trudy.
Good morning, everybody. Good morning to the listeners of Q95 FM Radio. Good morning to the listeners of Health Vibes. It is another beautiful Wednesday morning in the Nature Isle, and the Jolly's team is on with you as usual to bring your health education program with a little humor, a little vibes. It is the week after Carnival, and I know that many people may be suffering from the effects of the Carnival flu. I don't know what is the designated name for the seasonal flu this year, but if you are one of the people who unfortunately have been under the influence of that virus, I want to just wish you best wishes. Hope that you get well soon. Leona, who is supposed to be on with me this morning, unfortunately she's not well, so I just want to send out some wishes for good recovery to Leona and anybody else who may be down with the Carnival flu. Good morning to all our regular listeners. I see our listeners popping up on our social media, Q95 FM's Facebook page and YouTube channel. Good morning to you guys who always grace us with your presence on a Wednesday morning. Hazel Ann, I see you. Good morning to you and all the others who are popping up on social media. Of course, if you're listening to us on radio, you can go across to the Facebook page of Q95 FM or the YouTube channel of Q95 FM where you can view the show live. We do have a guest this morning, and we will be introducing her and the topic shortly, but we're giving you a chance to pop on to the social media platforms to look at the show live. This week, of course, as I said, post-Carnival, people are, in general, I guess, calming down, getting a bit more rest than they would have in prior weeks. Last week on the program, we gave you a lot of tips and hints about rest and recovery and things that you can take if you feel like you need some help in recovering from respiratory illness. So I hope you can, utilize our tips. Jolly's is always available for you. We advertised last week that there is the popular COVID pack. If you want that immune boost, that is still available at Jolly's for you. It contains vitamin C, vitamin B, zinc as well, vitamin D. So if you want to pick that up to give yourself a little boost in this period where it's heightened respiratory illness time, you can feel free to do so. Coming up in April, I want to give a very early indication for all of you who look forward to Jolly's runs, national 5K runs. Saturday, the 25th of April. You need to save that date. Jolly's National Wellness 5K run coming back on stream on the 25th of April. That's a Saturday. And this run this year is we're running in recognition of and to raise awareness and to raise funds as well for persons living with disabilities. So the Jolly's National Clinic, Jolly's Pharmacy, partnering to do the 5K run on the 25th of April, and it will be for persons living with disabilities. Now, as we always say, if you cannot run, you can walk, but participation is what we really, really want to encourage. We will be giving more details as the time draws nearer, but you can mark your calendars. The 25th of April is the 5K run or walk, depending on what you want to do. All right, so make sure you take a note of that, and we'll be giving more details as the time draws nearer. So what I'm going to do, because I know that the people who I see popping up on social media are already seeing my guest who is in studio. The people who have maybe seen the flyer for the show already know who the guest is and what we'll be talking about. But for those of you who haven't joined the social media page yet, I'm giving you that opportunity. I'm going to take a break, and when we come back, I'm going to introduce our guest and our topic. One of our listeners has said that the name of the flu is batting too long. I don't know if that's the I don't know if that's the agreed upon name amongst the whole population, but I'm being told by a listener that the flu is called batting too long. I don't know about that, but stay tuned. We'll be right back, and we're gonna let you know who's our guest and what's our topic right after these messages.
Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts, pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare. Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. Shop with your daughter, with your son. Shop it to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. Shop it to everyone. What a happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
We got this morning feeling mystic. I had the patience to call it sick, but I end up in Jolly's Pharmacy. Great and out in the street, Jolly's fix up my immune system. Me feeling fit and strong, now I'm ready to work like it on any mission. If you see me again, Jolly's Pharmacy is number one, Jolly's for you. We cater for everyone, Jolly's for you. Your immune system Jolly's for you. Yo, Dominic is the boy Father Box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
And And we are back with you. Of course, this is Health Vibes, and you're tuned in to Q95 FM, the big station. And we are bringing you a health education talk show with a little vibes, a little humor. The humor has already started because I'm seeing my listeners. The listeners are suggesting names for the flu. So before the break, I saw the suggestion of batting too long. Now I'm seeing that the name is Lisa, and I guess the suggestions will continue to come in as to what is the name of this year's post-carnival flu, or what we call the seasonal flu, right? But we do have a guest in studio this morning, and we have someone who is not a stranger to the program. She has been on Health Vibes in the past, but it's very difficult to get guests like her on the program because they are very busy. And so anytime we have the great opportunity to have someone like our guest on the program, we need to be very happy. Today we have Dr. Alison Abel Seaman on with us, and she has been on before. Alison, good morning to you.
Good morning.
I said Alison, I should say Dr. Seaman. Good morning. How are you doing this morning?
I'm not too bad.
Okay.
But I go by Dr. Abel. If you go to the hospital and say Dr. Seaman,
they won't know.
They won't know. So
okay.
It's Dr. Abel.
Okay.
Abel.
Okay. So what does the husband say about that?
It's been accepted.
He's been accepted. Okay. I always wonder about that and doctors and their maiden name versus the married name and what, doctor, what they go by. But Dr. Abel. Okay. So anybody who maybe has been to her would know her as Dr. Abel. She's a vascular surgeon. She's in the house with us this morning. She's been on Health Vibes in the past, but in the past, we've spoken specifically about certain vascular issues. I remember one of our shows, we spoke about venous insufficiency, peripheral artery disease. But this show, the topic is diabetic foot. Now, diabetes is a pretty common chronic disease in our population. That is type 2 diabetes mellitus, quite common. And so it warrants a discussion about one of the complications of diabetes, which is the diabetic foot. But I'm going to let Dr. Abel in the intro to this topic. Let us know, first off, how her specialty as a vascular surgeon correlates to diabetic foot. Because as I said, we've spoken to her in the past about vascular issues. But what's the correlation? Why, doctor, are you so integral in diabetic foot care and therefore are well suited to discuss that topic this morning?
Okay, Trudy, before I answer that question, I want to give some interesting facts about diabetic foot. Okay. Diabetes is a worrying entity, not only locally, originally, but worldwide. And it is estimated that within the next 10 to 15 years, 500 million people will be newly diagnosed with diabetes. So in the next 10 to 15 years, 500 million people will be newly diagnosed with diabetes. Okay. 1 in 3 people suffering diabetes will develop a diabetic foot ulcer. Yeah, very interesting. The number 1 cause of non-traumatic ulcer is diabetic foot ulcer. The number 1 cause of non-traumatic foot amputation is caused by diabetic foot ulcer.
So, Doc, when you say non-traumatic, you mean not an injury,
not an accident,
not an accident.
not from
Okay.
an accident.
Mm-hmm.
Okay. Every 20 to 30 seconds, somewhere in the world, a limb is being amputated because of diabetes.
Wow.
Every 20 to 30 seconds. This is eye-opening, it's alarming, and it's frightening. Every 20 to 30 seconds, somebody's losing their limb because of diabetes. Okay. With an amputation, so if a patient suffers an amputation, the mortality rate of that individual in the first year rises to 40%. In the next 3 years, it rises to 65%. And within the next 5 years of that amputation, the mortality rate is increased to 80%.
Wow.
So that is increasing, it is alarming, and it is comparable to cancer. It is comparable to cancer. Okay. So what exactly is diabetic foot? The diabetic foot is a complication, one of the most feared complications of diabetes, and it is the ulceration, infection, and destruction of the tissues of the foot of an individual suffering from diabetes. It is associated with neuropathy, nerve damage, and angiopathy, circulation issues. So that is where I come in.
That's where you come in. Okay.
Okay. And it is usually as a result of some sort of nail prick, a tight shoe, an insect bite.
So, okay.
Okay.
We'll talk a little bit more about the risks as we move along.
So when I say nerve damage or neuropathy is nerve damage, that's where the person loses sensation in their foot. And circulation issues, not enough blood flow is going to that leg because of peripheral artery disease. So the clogging up of your arteries to supply oxygen and nutrients to that wound to provide healing.
Okay.
So that is where vascular surgery comes into play.
Okay. Now, but you've given us some startling statistics about the prevalence of the diabetic foot, the high rate of amputations as a result, diabetes in and of itself, and how prevalent it is. But a lot of people kind of struggle with the diagnosis of diabetes. Who is a diabetic? Who is a diabetic? Who is who is at risk for what we're speaking about in this show, which is a complication of diabetes, diabetic foot? A lot of people may struggle with the definition because they don't want to accept a diabetes diagnosis, or neither do they want to consider one. A lot of people, because it's so common, say things like, I have a touch of sugar, or I have sometimes my sugar is high. But what is, by definition, what is a type 2 diabetic, and who should be concerned about the complications of diabetes?
So all diabetic patients, type 1, type 2, are at risk of developing diabetic.
Okay, so both type 1 and type 2.
Both type 1 and both type 2.
Okay.
Okay. So they are all at risk of developing diabetic foot. Yes. So.
And your diabetes diagnosis, if you're checking your blood glucose and you've had elevated readings, but you've never received that official diagnosis. You're not on
Diagnosis.
medication. You're just trying to, you know, control your levels yourself, or possibly you maybe had one high reading in the past, but you never passed back to check.
Check on it. Yeah.
Yes. So what should people be looking to confirm or to know? Okay, I am a diabetic and I need to, you know, be listening to this information.
So one of the diagnostics of diabetes is a reading, an RBS reading, a blood sugar reading, a random blood sugar reading that is more than 200 milligrams of deciliter. Okay.
Okay.
So once we have that high reading, we can consider you a diabetic patient. Okay. This patient should as well do an HbA1c.
Okay.
The HbA1c allows us to determine the level of your sugar has been for the past 3 months.
Right.
Okay. And then with that now we can place the patients on their medication, whether it be metformin and insulin. We also have to do an insulin and hormone test to determine what is the level of insulin your body is or is not making.
Okay.
And then we can place you on the prescribed medication, whether the person has to be administered insulin or they can use oral hypoglycemiants like metformin, glyburide.
Okay. Now, a diagnosed diabetic, a diabetic who is on treatment, they have controlled blood glucose. They've been checking and their blood glucose is controlled. They don't have high readings. Are they at risk for the complications of diabetes?
They are at risk.
Okay.
But the risk is lesser.
Okay. So lower risk.
Lower risk.
But still a risk.
Yeah, but still a risk.
Okay. So people should still be listening to this information intently, even if they are controlled diabetic.
Yeah. Once you're diabetic, you are at risk.
Okay.
So there are different grades of diabetic foot. So we have from grade 0 to grade 5.
Okay.
So a grade 0 is a patient who does not have any lesions on their foot. However, they are at risk. So all diabetics are considered a grade 0.
Interesting. Okay.
Yes, they're all considered a grade 0.
Okay.
Okay. And then depending on how the wound goes on, we diagnose with a grade 1, grade 2, and the most severe a grade 5.
A grade 5.
Yeah.
Okay. So grade 5. So grade 0 is all diabetics. No,
you're at
don't.
risk. So you may have some sort of callus. You may have some deformed toe.
Right.
But there is no open lesion.
Right.
There is no swelling. There is no redness. There is no pain.
Okay.
It's just a foot that is at risk.
Okay.
Okay.
And all the way to grade 5.
Grade 5.
Which is, what would be a grade 5?
You saw my status, right?
Yeah. So would that those pictures that you sometimes show of the open wound.
Yes. So a grade 5 would mean that the patient is severely infected with dead skin, necrotic skin, and it can lead to amputation of the foot.
Okay. So let's go into a little bit of how an injury, and you had started to mention some ways, that a foot injury could occur, which could lead eventually, to the varying stages of diabetic foot. But let's go into how this can happen. You mentioned tight shoes a little earlier, or maybe a prick of a nail or something like that. What else is possible? Or what are the common ways in which, people injure their feet and don't even realize it?
Okay. So we have 3 main factors that can lead an individual to a diabetic foot. The one is the nerve damage of the nerve, or neuropathy. That means there's loss of sensation. So loss of sensation is a warning sign.
Okay.
Because you don't feel that you are pricked. In the past year, I have had patients who have suffered a nail prick. just from walking barefoot outside. I have had patients with staples embedded under their feet.
Wow.
The grandchild was doing some art project in the living room, and he ended up walking on these staples, and it got embedded into his foot, and he did not realize, he did not know, because he has lost sensation under his foot.
Wow.
Okay. I have had another patient where a glass broke inside of his kitchen, and he would have thought that they swept up all the broken pieces of glass, and unknowingly he walked on a piece of that broken glass, and that itself got embedded under the sole of his feet. And it took a while, about 2 weeks, before his wife noted the swelling, and before they started with seeing the secretions when he walked. There's something coming out from under his foot. Okay. So the most frequent causes I have is because of they walking barefoot and they got pricked inside the house or outside their house. I have had an ant injury, an insect bite as well.
An ant?
Yes, an ant.
Wow.
Yeah. An ant, the individual, he started with some redness and it developed into an abscess and diabetic foot.
So something as minor as an insect bite, an ant bite, I don't think many people would consider that, because we often hear about the don't walk barefoot, because you might be exposed to something that can prick your foot or injure your foot. But the insect bites, that's alarming.
So another factor, so we talked about the nerves. So the nerve is the loss of sensation. Then you have the poor circulation. The poor circulation comes about from the arteries being clogged up. What are the arteries? The arteries are the part of the circulation that carries blood rich in oxygen, blood rich in nutrients from the heart, and brings it to all parts of your body. Okay? These arteries, over a period of time, they get blocked up. So think of a pipe flowing with water. And over the course of years, what we call the muck starts to build up inside of that pipe. So in a diabetic patient, the high sugar levels, the high cholesterol, high fat, these start to build up in the pipes that transport the blood. And slowly, these pipes get blocked up. So when these pipes are clogged up, there's no circulation going. And the circulation is important for life. And once that happens, now you're going to have a wound that is not healing as fast as it should. And that is what happens with a lot of the diabetic patients. They too suffer from peripheral artery disease. Okay. And in a diabetic patient, the peripheral artery disease speeds up 4 times faster. So in a non-diabetic patient, you may see this entity in a patient who is 70 years old, 80 years old. However, in a patient who suffers with diabetes, we may start to see it from 40 years old, 40 years old. Okay, so it happens 4 times faster in a patient suffering with diabetes.
Okay.
And diabetes as well, it causes your immune system to be a bit weaker. So the healing process becomes slower. So all these factors, the nerve, the loss of sensation, the poor circulation, and being immunocompromised contributes to an individual presenting for diabetic
foot. Okay. And that's what I guess you'd call a triple whammy. So the nerve issue, the peripheral artery disease, and as well as the compromised factors associated with the disease.
Yeah.
Doc, I'm going to ask a question that, it might sound like a duh question, but I'm sure people have wondered why do we only talk about the diabetic foot? What about the other extremity, the hands? Why isn't there a loss of nerve function and the same things that we've discussed? Why can't that affect the other extremity?
It's a good question.
Mhm.
Because of the pressure our body have on the feet. So the
Okay.
constant standing as well, everything bears down on your two legs.
Okay.
So it is the most frequent
Okay.
area of the body to get injured.
Okay. So it's just the utility of the lower limbs as compared to the upper limbs.
No, diabetes is not saying that I am only going to affect your foot.
Okay.
It affects from your head
Uh-huh.
to your toe. So that is why you will see a lot of patients suffering with diabetes. They get stroke.
Mhm.
They get blind, what we call diabetic retinopathy.
Mhm.
They get a heart attack.
Mhm.
They get kidney damage, diabetic nephropathy. Okay, and they get artery disease.
Mhm.
So a patient suffering with diabetes needs a multidisciplinary team to help manage them. So you will need the ophthalmologist,
Mhm.
you will need the cardiologist, you will need the endocrinologist, you will need the nephrologist, you will need internal medicine, you will need orthopedic surgeon, you will need a vascular surgeon, and also a podiatrist, okay, to help manage this entity, because the complications is a systemic complication.
Yes, the entire body.
The entire body.
Okay. I want to delve a little deeper into the patient who has been diagnosed with diabetes and their process of care, specifically as it relates to preventative care for the complication of diabetic foot. So you've just mentioned all the different specialities that need to come into play to manage the diabetic. I want to speak specifically to the diabetic foot, which is what we're discussing today. I am a diabetic and I want to make sure that I am preventing a possible amputation in my future. I want to make sure I am addressing in advance the diabetic foot complication. What is my game plan?
Okay.
I know there are a lot of different game plans for all the different things you mentioned, but just for that one in particular.
So preventative measures for preventing a diabetic foot.
Yes.
Okay. So one of the first pillars into these preventative measures is the control of the sugar,
Okay.
the blood sugar level.
Mhm.
We try our best to keep these numbers as low as possible. So between 150 to 200 maximum.
Mhm.
Okay. That should be your daily reading, less than $200.
200
less than 200 milligrams per
deciliter.
deciliter. Okay. So
Mhm.
one. Because when you have the high sugar readings, they increase the risk of developing the artery, clogging the arteries. So you want to be mindful of that. So this includes as well managing your diet. The exercise is important.
Mhm.
Okay. Daily foot care. Daily foot care would involve not walking barefoot
Mhm.
inside as well as outside of the house. So inside you can use your socks, a comfortable socks, not too tight. Your socks acts as a first level, a first barrier to whatever injury that you may sustain. So for example, the thumb tack or the nail will have to pierce
The sock
through the
first.
socks before it can get embedded into the sole of your feet.
Mhm.
Okay. On the daily foot care again, you wash your feet daily with warm water. You clean in between your toes carefully to avoid moisture buildup. You keep in between the toes as dry as possible, and you moisturize your legs. The moisturization is very important to prevent cracks from in the skin. What happens with the cracks? The cracks, sweat, bacteria from the skin can enter into those cracks, the dry skin, and can prevent an ulcer. So you always want to have a good moisturizing lotion. We have shea butter, cocoa butter, the cocoa butter, vitamin E oil, coconut oil to keep your feet moisturized, to keep your skin moisturized every day. You do not put moisture or the lotion in between the toes. We don't want moisture in between the toes because you're having a high risk of developing a fungal infection with that moisture in between the toes. So you keep in between the toes as dry as possible.
Okay.
So
the moisture rising is for, I would say, the skin, the heel.
Some of the foot, the front part of your foot, the legs, and the heel to keep it as moisturized as possible.
Jolly's actually has a product this week as product of the week called Crack Happy Feet by Dr. Scholes. So it's a specialist heel cream to moisturize and soothe and heal cracked heels. So I guess, that is also something. And I heard you mention, Doc, the vitamin E as well, the vitamin E oil. I heard you mention too the shea butter. So there are varying options for the moisturizing of the skin in that regard. Yeah. Okay. But not between the toes.
Not between the toes.
Right. I think that's important to repeat.
Not between the toes. We also want to be mindful of the pedicures.
Okay.
The pedicures. I've had patients who have lost their toes because of a pedicure that they did a month prior or so. So we have to be very mindful that the instrument that they use to grease caused injury to the individual, and she eventually lost her toes because of that. So we have to be very careful.
And Doc, I mean, this is something I think I've said that on previous programs, but I will reiterate. It's not often, or it's not common practice, I don't feel like, for pedicurists or spa providers to ask about the patient's medical history, whether they are diabetic or not. I notice people just get into the chair and start the service, and almost a one-size-fits-all approach for all clients in various spas. But I think we should get more in the habit of sensitizing those providers that it is a risk, a high risk for a diabetic accessing your service if they get a nick or wound, or a cut, whatever it may be.
And just to talk about the pedicure, the way that you cut your toenail is important as well.
Okay.
So you cut your toenail horizontally instead of using the nail clip and try to cut into the sides of the toenail, because you're at high risk of clipping the skin. And when the moisture settles in there, the bacteria start to proliferate. So you always cut it horizontally, and you can use a file to file it down a little lower, but in a horizontal
fashion, straight across. Yeah. Okay.
We also want to talk about the footwear in a diabetic patient. We want to have soft, comfortable shoes. Just sometime last year, I had a patient she went to a festival and a fete, and she had the dressing was supposed to match the color of her clothes. So the shoes that she wore was uncomfortable, and standing up for the entire night with water going in there. And the next 2 days she was admitted at the hospital because on both areas of the toes, the same toe on each foot were affected, And she almost lost them, but she came in a timely fashion. So that was very good upon her. That was very good of her. And she got the antibiotics. So the footwear is very, very important. Sometimes when you lose the sensation of your feet, you don't feel that pressure that you would normally feel. So the shoe may be tight, but you don't feel that pressure. Okay. So the friction is happening there and you don't feel it. And then a few days will go by and a bleb is formed. And that bleb fills with water, it bursts, it gets contaminated, gets infected, and gets septic and causes a severe ulcer on that leg. So the footwear is very, 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 very important for a diabetic patient. Okay.
So we're talking comfort, not tight. What about open shoes, flip-flops?
Flip-flop is a no-no.
No. Okay.
Flip-flop is a no-no. You need something to protect not only the under part, but the upper part of your foot. Okay. And flip-flops don't do that. Slippers. And that is a common wear in the Caribbean.
Oh, yes, definitely. Definitely. So a lot of people, I mean, that's what they wear.
Grew up with, yeah.
Yes. So we want to avoid those. Once again, we're talking preventative considerations for diabetic foot if you're diabetic. So we've spoken about some of the practices that you have to engage in: maintaining your blood glucose levels, securing your feet, wearing socks inside and shoes outside. Now we're talking footwear, comfortable shoes, not flip-flops, not tight shoes, restrictive shoes. Okay.
And also, in continuation, inspect your feet daily. Very, very important. You inspect your feet daily. If you're unable to do it, a family member, whoever you live with, let them look under your foot.
Okay.
Daily. Because something that may not be there today, tomorrow, it can be picked up. Okay, just by looking under your feet every day. If you cannot reach, use a mirror so you can inspect. Because sometimes you may work on something and you not feel it today, but if tomorrow you look under your foot, I say, hey, that wasn't there yesterday. That wasn't there yesterday. So early detection can save an amputation. Okay. If you notice anything under your foot, you go to your healthcare provider, let it be a nurse or your doctor. Again, early detection prevents amputation. Early detection prevents serious complication.
Okay.
Exercise is important. Daily walking, 15 to 40 minutes a day. This is essential for the circulation to help the blood flow, to help the blood flow better, increase blood flow, increase oxygen, increase nutrients to your lower limbs. So the walking is essential. Okay. We talk about nutrients, your type of your diet.
Your diet.
Is important. And what else comes to mind? Daily reporting and daily care. Yeah.
Daily care. Okay.
Yeah.
And you did mention too in my summary, I forgot the moisturizing of the moisturizing as well. So I'm going to transition a bit now into if somebody unfortunately does have an injury to the foot and how treatment would then proceed. But before we do so, we've been getting some calls. Let me open up the lines at this time to allow our listeners to interact with Dr. Abel as we are discussing diabetic foot here this morning on Health Vibes. So the numbers, if you'd like to call in, 449-3095, 449-3096, 449-3097, and 616-4257. If you'd like to reach us and you're overseas, the number to call is 305-432-9624. Okay, so the lines are open, so we can use the remainder of the program to engage with some of our listeners. But Dr. Abel, you were speaking about all these ways, preventative measures, what we need to do or consider on a daily basis to prevent the occurrence of complications surrounding diabetic foot. But let's take a call. We have a call. Let's take a call. Caller, good morning.
Good morning, is that Kyrie? Q95?
This is Q95.
Okay, is this Matt's program?
No, this is Health Vibes, Jolly's Health Vibes.
Oh, sorry.
Okay. So we are, yes, Doc. We're discussing what if somebody does unfortunately have an injury? The preventative measures maybe did not adhere to, and unfortunately they have an injury, they have a nail prick, they have a something, and it is discovered after a long time. So they're presenting now to you with an advanced injury. What's next?
Okay. So the patient sustains a prick or nail prick, trauma to their leg, and what they should do, the first thing they should do is go to the healthcare provider. Let the healthcare provider inspect the wound. Okay. Again, this goes back to the different grades of diabetic foot. So as we said earlier, the grade 0 is a patient who at risk. So we have a grade 1 and a grade 2 diabetic foot, which can be managed at home. Okay, so with early antibiotics, antihistamines, pain medication, these patients can be monitored at home. Daily monitoring of their sugar, their diet, and with antibiotics care and wound care. So in a grade 1, the wound would be a superficial wound, maybe a bit red with a little swelling. Okay, so that is something that can be monitored at home and given prophylactic antibiotics as well. Just as a grade 2 can be monitored at home. The redness may be increased, the swelling may be increased, but the wound itself does not have any signs of pus coming from it or any offensive nature coming from it.
So
okay,
no sign of infection.
no signs of infection
Okay.
to see. So that as well can be monitored at home with prophylactic antibiotics.
Okay. So
Okay.
that's stage 1.
That's stage 1 and
and
stage
2.
2.
Okay.
So grade 3 diabetic foot will definitely need to be admitted. Why? Because an abscess is formed, and an abscess is collection of pus, purulent secretions. You may have some dead skin, dead tissue that maybe need to cut off. Okay, and admission would be required to get IV antibiotics or IV antibiotics. Dual therapy, two different types of antibiotics to cover the different types of germs that can infect the foot. Okay, so a wound debridement maybe will be necessary. There may or may not be an amputation of a toe. So it all depends as well. So a grade 3, you definitely have to be admitted.
Okay.
Then we go on to a grade 4. A grade 4. Yeah.
Let's pause here. Let's take a call. Caller, good morning. Good morning.
Yes, good morning.
Hi, caller. Good morning.
Yeah, very, very important information. Thank you for joining. Honestly, giving us a very important information. I was concerned. I was reading somewhere when they were saying if you are diabetic, you should not take to, if you have a warm bath, take a warm bath. It may be very good for you. And then the question asking, it may not be very good to take hot bath or warm bath. And 2, if you have a foot soak, it's also said that if you're using foot soak, you should not use warm or hot water in the foot soak. Especially so if you use Epsom salt, so you can use Epsom salt to help you to wash the foot. But the whole question I'm concerned with the warm, because we have diabetes, they say, well, you should use warm water or warm bath or anything like that. Is that true or so? A very important information. Thank you for it.
Okay. Thank you, caller. Yes. So the question to the doctor, if you should, as a diabetic, take warm baths, hot baths, and if you can use foot soaks in warm water and use Epsom salts as well, he mentioned. But his main question is about the heat of the temperature of the water.
So lukewarm water is advisable in daily care of your foot. It doesn't have to be too hot. We don't want it hot. That can cause burns to your skin, as well as very cold water can cause burns to your skin. So warm water, warm wash is advisable to help remove the germs and bacteria from the foot. Okay. And soaking is not advisable. Okay, because with the soaking, the moisture adheres, especially under the toenails of your feet. And if you have poor circulation, you want to avoid that. Okay, so soaking is not advisable, but the daily warm wash is advisable.
Okay. Interesting, because just last week we spoke so much about, like, for pain, if you've been standing long and you want to relieve your foot pain, you may do soaks. But of course, with varying conditions, that is not applicable to everyone. So the doctor has just, clarified, if you're diabetic and you already have circulation issues, that the soaking of the feet is not advisable. Okay, that's good call. I hope that answers the question. Yes. So, Doc, we were speaking, we were progressing through the stages of diabetic foot and what treatment options would come into play. So we were at stage 3 would require hospital admission and, observation and so on, maybe debridement of the wound and so on. And I think you were going to go on to stage 4.
Okay. So a stage 4 is more severe than a grade 3, where you have osteomyelitis. That means the bone, the infection is that deep that the bone is affected.
Wow.
And the extension of the wound, that person will require an amputation, maybe a toe, 2 toes, or all of the toes. Okay.
If you say the bone is affected, is that you can see the bone at that stage? Would it be something that's so deep that the bone tissue is visible or not?
It may not be visible. It's just that the infection has reached so deep into the bone.
Okay.
And then you can detect that using an X-ray with the osteomyelitis, the bone infection, and amputation, as I said, will be necessary for that. Okay, so it can be either, depending on how extensive the wound is, maybe 1 toe, 2 toes, or all of the toes will be removed. Again, the patient will require stronger IV antibiotics, and sugar monitoring. The diet is important. Okay, and then we have a grade 5, where that individual would maybe require a below the knee amputation or an above the knee amputation of that limb.
Before we go into that type of amputation, let me just go back a bit to the amputation of the toes. What is the functionality of a patient's foot or their walking ability and so on if the toes have been amputated?
Okay, so that's a very good question, Trudy. Your foot, we have 3 main pressure points. So the pressure points are under the 5th toe, the baby toe, the big toe, and the heel. Okay, so if you lose the 3 toes, God forbid, in between, the 3 middle ones, you will still have functionality because the 3 major points are still intact. Okay, but once you lose the big toe, you may have a little unbalance going on here as well as the heel. The small toe, not so much, because you still have that main foot here, but the big toe especially and the heel, once you lose that, you can the balance. You may use a stick or a special type of footwear, a diabetic footwear, to aid in the ambulation
Okay.
process.
Is the diabetic footwear, I'm envisioning something like a boot sort of, is that what it is? Or that's an orthopedic?
There are different types. There are
Okay.
different types. There's the boot we call an offloading. It's an offloading boot to help alleviate the pressure on the foot.
Okay.
And then we have the diabetic, the shoe, the diabetic shoe that is soft and comfortable that you can use daily.
Okay.
So there are different types.
Okay. Okay. So we were moving on to the stage 5 or grade 5, where you were indicating that an amputation above or below the knee would be required. Or that is the major, I guess, most devastating outcome that somebody could have.
No, although we have had a grade 5 that has healed with patience, with love, and with treatment, obviously. But generally, it may lead to amputation of the limb. It all depends on the patient's age and the immune system, how they respond to it. Okay.
What's the youngest that you have seen somebody have to have an amputation above knee, below knee amputation?
And also the vascular nature is important.
Okay.
So when the patient is admitted, whether from a grade 3 to a grade 5, we do an ultrasound to determine what is the flow of blood in the limb.
Okay.
And it will let us know if we will have a good healing process or it may be poor.
Okay.
Now, there are different types of vascular surgeries that can be done to provide better circulation to the foot. However, we are limited here. So sometimes we may end up with the amputation. So when I mean we are limited here in terms of resources at the institution, okay? But there are procedures that can be done to help improve circulation to the foot.
And when you say that, would that procedure then eliminate the amputation
it
risk?
lowers the risk of having the limb amputated.
Okay. But yes, I was asking about it because I'm thinking, as it relates to amputation, of course, the impact on life, quality of life. An amputation is a major life change to lose a limb. And so my question was, as it relates to age, if you have a patient, what is the youngest age that amputation, or you've seen amputations having to occur in patients as a result of diabetic foot?
Major amputation, I think mid-30s.
Wow, okay.
But that was in my studies when I was in my program, mid-30s in Cuba. The individual had type 1 diabetes and she suffered severe peripheral artery disease. Okay, so her arteries were severely clogged up without any she will not be able to benefit from the vascular processes to help. So we had to amputate her. Below the knee amputation, so she will have a prosthetic made for her eventually.
Okay, so if the amputation is below the knee, it allows for a prosthetic
a limb, prosthetic limb. Yeah.
If it's above the knee, no?
You can get a prosthetic limb as well. Yeah.
Okay.
You get a prosthetic limb as well.
Okay. All right. And any incidents of double amputations? Yes. Okay.
Yes.
So in that instance, somebody has on both
limbs amputated. There's another fact that I did not mention, but if you have one major limb amputation within the next 3 years, the other limb may be amputated as well. Yes, so that's a high number.
Why is that?
Well, the individual will put more pressure
On the other
on
limb.
the other limb, on the healthy limb, and more risk for wounds, the sores, the pressure sores, and the porkia as well contributed to that.
Okay. All right. Let's take a call. Okay. I think let's try again. Caller, good morning.
I'm here again.
Okay.
I just want to know what is the minimum, or let's see, I have a meter, and I check, and sometimes I get things that reading like on like 157, 132, 309. No, sorry, yeah, and those things. I'm over 40 years, almost 80. And then what is considered it? And there is somebody really like really work breakfast time.
Caller, hold on. We're not hearing you clearly. Can you repeat? You said you readings of what numbers were you saying? We're not hearing you clearly.
Sorry, my phone giving problem.
No, it's just yes, just yes.
You hear me?
Yes.
You hear me now?
Yes, you can go ahead.
What is considered as a good reading in terms of, I have a meter, and sometimes my reading shows 130, 137.
Okay.
So on and come and go, you know? What is considered at my age, above 70, 75? What is considered a good reading?
Okay. And those readings, you taking them fasting?
And also, how do I, if everything keeps, I don't want that to happen to me, that would happen to me. Is there a way you can give you can get a leg or something? It's a
prosthetic?
I thought, yeah. Then we can get, you can have to buy it, or you have to get it free, or
okay.
Just a question asking.
Okay.
Okay.
Caller, but the readings you mentioned, was that your fasting blood glucose? He left. Yes, but he mentioned some readings of blood glucose. He said 130, 157. I think he mentioned. I didn't get from him what time of day readings were those, and then he also asked about prosthetics and how would these be available to someone who has an amputation. So 2 questions, Doc.
Okay. So again, each individual is different. So one person, a reading of 150 may be too low for a patient and it can be considered hypoglycemic, whereas a reading of 120, 110 for patient can be considered okay for them, normal for them. So every individual in their stage of their life is different. Okay. But the ideal reading for a diabetic patient, 150 to 200. Okay, we don't want to pass 200 at all. And less than 150 can be hypoglycemic for some individuals. Okay, so you have to know your body and what works for you. So we want less than 200 to prevent complications. Okay, and 150, less than 150 may be acceptable in some people, depending on how they feel. So they can go hypoglycemic. Okay, so it all depends on the individual.
Okay. Well, yeah, I guess, and he was speaking about his age. So I guess that's a conversation to have with your physician. What is acceptable specifically for you, your age, as well as the stage of the disease that you are in, and those sort of parameters. But then he also asked about the prosthetics and how would they be sourced if somebody has an amputation.
Now, the prosthetic limb, there is a private entity that does prosthetic limbs for individuals in, I think, in the Salisbury area. However, contact is being made through the help of the government to provide prosthetic limbs for individuals with amputations. Okay, we're in the process of, we have already collected. I had clinics sometime last year, 2 clinics where I did not realize we had such a high number of persons with amputations below the knee and above the knee, young as well as old. Okay, so we collected this data and the information be sent out to the entity that wants to help provide this prosthetic limb, so Dominica. Okay, so it's a process that is in the making for us.
I think the information about the complications of diabetes, yes, amputations, as well as the other complications, diabetic retinopathy and so on, it would be good to have that information available, just in terms of general, health education measures that people want to take. This is what is our picture in Dominica. I remember when I was studying in Barbados, it was said to be the amputation capital of the world because of the high levels of
Amputation.
Yes, in Barbados having a high burden of diabetes. At that time, that's years ago. I don't know if the picture has changed. It might be the same, but it would be interesting, for that health data as well. And I always advocate for that, for more available health data, so people can make certain decisions, comparisons, certain plans to move forward. I know the information may be there, but in terms of the access, yes, the access. So sometimes people are trying to do research and they don't know where to get information about certain things. But it's good that that information was collected, at least for the ethic provisions to be made. Dr. Abel, I want to just mention Vado has been communicating with us throughout the program, singing your praises, saying that she had come to you and that you had prescribed Veneton, and things have been working well for her. She said she cannot call because she's overseas, but she just wanted to shout you out here. So I couldn't finish the program without mentioning that Vado has been commenting throughout on our Facebook page, Q95 FM's Facebook page. So Vado, good morning to you, and I know you're a fan of Dr. Abel. So Dr. Abel, we were and we're approaching the end of the program, but we were discussing amputations and that being, sort of the last possible outcome of diabetic foot. But you mentioned, and I just want to go into that a bit, that you have successfully seen stage or grade 5 not result in amputations.
Yeah.
How is that possible? What is the treatment like? Because you said with a lot of patience and with a lot of love and I know maybe a lot of time. How is that possible to pull that person back from an amputation?
Okay. It is possible, truly, with debridement, removal of all the dead tissue that is there. It is possible with very strong antibiotics as well, and a long hospital stay. So diabetic foot patients have a longer period of admission to the ward. Okay, and wound care is very costly as well. There are different types of wound dressings that is required. So not everybody will require the betadine and the peroxide. There are other types of dressings that is necessary. We also use honey on the wound, very important. And somebody may ask, if I'm diabetic, why would you want to put honey on my wound? What honey does as a topical, when you place it on the wound, it cleans the wound. So it has a peroxide nature that keeps the wound clean. It acts as a bactericide, so it kills the bacteria on the wound, and it promotes or it favors a healthy environment for the granulating tissue. So all these aspects of honey, okay, helps with wound management.
That's so interesting.
And again, the individual, it also depends on the flow of oxygen and nutrients from your arteries to the wound. So that the peripheral artery disease affects whether or not that limb is salvageable.
Okay. Wow. So I've seen you docs show some very distressing wounds, and you've shown the progress of healing of these wounds. How I don't even know how to, but how would somebody with a very open foot wound, if the person is not hospitalized yet, how do the hygiene aspect of having a wound like that is what I want to ask you about.
Okay. So that is what our population, they believe that home remedies will cure, or bush, quote unquote, bush will help the wound. So they stay at home longer, delaying treatment, getting the wound worse instead of coming to the hospital. So when they come to the hospital, they come with that. Okay, so they try the bush, they try all sorts of remedies, and instead of the wound getting better, they get worse, and last resort, they come to the hospital. Or they go to their health center where they say, hey, how you have that at home? And so this is another social aspect that we have to look into as well. The people, they have fear, or they are stigmatized, and they come in late. They come in late because of that. And by the time they come in, sometimes we just have to do an amputation of two toes because of how deep the wound is. They have a choice. So they come in late. And for some of them as well, they have the nerve pathology, so they don't feel it.
Okay.
So if they don't feel it, they will say it's not that bad, when in fact it is very bad.
Okay. Yeah.
Very bad.
Okay. So I guess, and as we wrap up, as we have to, it's 11:31 a.m. Doc, I just want you to share with our listeners. Of course, you've guided us through the whole picture of diabetes and what it is, the complications, one being diabetic foot, and then the ways that or the stages or the grades of diabetic foot, how we can prevent severe diabetic foot complications, and then how we can treat. That's the pathway that you went through. I would like you to share with our listeners any contact information for you if they feel, and let them know too when they should see you. You did mention a host of specialties that are needed to care for the diabetic patient and to manage the disease, but when should they see their vascular surgeon?
Okay. So once you are diagnosed with diabetes, you should start to see your healthcare providers, all of them. Okay?
All of them. Wow.
Yes.
Okay.
Because
somebody might say, all that? I don't have money for all that. I can hear people saying that.
But the earlier you get to your doctors, your complications
are minimized.
So it is better to spend all that early than to save the complications of going blind, the complications of losing your kidneys, the complications of losing your feet later on. It's very, very important. Okay. So yes, as soon as when you are diagnosed with diabetes, you start to see your doctors, you do your eye checks, you do your blood test to check on your kidneys, you do your vascular ultrasound to check your circulation status, and your cardiologist as well to check the status of your heart as well. So all that is important. Every diabetes affects every part of your body, and the sooner you have this done, okay, so you know that is your baseline, and then every year, every 2 years, you do a routine follow-up to see how you have progressed.
Okay, so an annual or biannual follow-up. Okay.
Yeah.
All right. If a patient wants to reach you, how can they do so?
I can be reached at 285 9586.
So 285.
Yes, 9586.
9586. And you have a location?
I am now located at the Hillsborough Pharmacy.
Okay.
Yeah.
So you're in Hillsborough?
I'm at Hillsborough now.
Okay, so people would know on Hillsborough Street where Hillsborough is. So that's where you can reach Dr. Abel if you need to see her or make an appointment to see her. That is where, and of course, she's very thorough, as you could hear on the program. And from what I have seen in some of her pictures that she has shown of wound healing, she's definitely a physician, because some of the wounds I've seen her treat, I feel like I would have given up if I had just seen them. So the doctor is definitely the one of the more patient ones of us. Okay, so yes, people are asking if you move. Yes, so she's saying she's in Hillsborough now, so that's on Hillsborough Street. So if you want to see Dr. Abel, that is where you can find her. And Dr. Abel, just repeat the phone number one more time. I'm seeing someone asking for that as well.
285 9586. So you can call and they will reach the secretary. She'll answer the phone and she'll give you an appointment date.
Okay, 285 9586. Okay, so I'll also pin that in the chat on the Facebook page. So if you want to reach Dr. Abel, you can do so. Dr. Abel is a February born on a very strange date in February. So actually this year she doesn't have a physical birthday because she's born on the one day that comes around only every 4 years. But we want to wish her so she doesn't age. So right now she's very young because she only has a actual birthday every 4 years. Every leap year is when she has an actual birthday. But I want to wish her happy birthday in advance.
Thank you, Trudy.
And thank her, of course, for taking the time to come on Health Vibes and sharing the very valuable information that she did with us. So we are signing out from the program until next week, God willing, where we will come back again to give you a program with some health education and a little vibes. I do wish you a great week, a healthy week, and hopefully we'll be joining you next week. Until then, take care and bye-bye.
And Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.